Hi, my name is Torres, and today I'm going to be doing my presentation over kidney failure. Kidney failure is a life-changing event for both yourself and your family. Living life with this disease is not an easy thing to do, but at the same time, it's not impossible. Three main points that I'm going to be speaking on are the basic facts of what kidney failure is, the treatments you can receive, and being able to cope with this diagnosis. But before I speak on this topic, I want to go through some family history I have with kidney failure. In February 2012, my dad was diagnosed with stage 3 chronic kidney disease due to his diabetes. Later that year in September, he was diagnosed with stage 4 chronic kidney disease. With all the doctor visits, his kidneys not showing any improvement, June 2013, he began kidney treatment at a dialysis center. He still to this day is continuing his treatment at the dialysis center. Just when we thought things were somewhat getting back to normal, my mom was diagnosed with acute renal failure after being hospitalized for being ill in May of 2014. A few weeks after being in the hospital, she began kidney dialysis treatment at the same center as my dad. Months went by, she was doing her treatment. They started to explain to her that she was a good candidate for a kidney transplant. She went through the process and was placed on the transplant list in November of last year. Now, she just recently began her at-home peritoneal dialysis. As I go through my presentation, I'm going to be talking about my parents' experiences and different things that they had to go through. Kidney failure can happen very suddenly or slowly over time. Some of the causes of kidney failure could be diabetes, uncontrolled high blood pressure, autoimmune diseases such as lupus or HIV, genetic diseases such as polycystic kidney disease, injuries, medications, or even drugs. Now I'm going to go through some of the different things. These are two types of kidney failure. We have chronic kidney disease, which has 5 different stages that can lead to acute renal failure. Now, my dad, when he was diagnosed with chronic kidney disease, he was diagnosed with stage 3. Some of the symptoms they have are anemia, early bone disease. He then was diagnosed with stage 4, fatigue, swelling, nausea, and vomiting, and then there's numerous amount of things that lead into it, which can lead you into stage 5, which is considered kidney failure, which is when he started his dialysis. Now, my mom, when she was hospitalized, she pretty much passed up all the stages, went straight into acute renal failure, and began her dialysis right then and there. As I stated on here, some of the symptoms are decreased urinary output, swelling due to fluid retention, nausea, fatigue, and shortness of breath. Now, once you're diagnosed with one of these, whether it be chronic kidney disease or acute renal failure, it leads you into having dialysis. There are 2 types of dialysis. There's the hemodialysis and then there's the peritoneal dialysis. The hemodialysis, you have 3 different ways that you can get it done, which is through a fistula, which is in your lower arm, a graft, which is a synthetic tube implanted underneath the skin, or a venous catheter, which can be in your neck, your chest, or even in your groin area. My dad currently has the fistula, which is in his lower arm, and he does that inside the center for 3 days a week, and he does it for 5 hours a day. My mom like I said, she was doing hemodialysis with my dad, which she had the catheter in her neck, but she just got trained to be able to do her dialysis at home, which is called the peritoneal dialysis. Now what that is you basically have to be in a room by yourself. She hooks up a tube, which puts the dialysate into her stomach. It's kind of like sugar water, so it eats up all the liquid and stuff on the inside. And then she does that for about 10-15 minutes, then she drains it out and puts a new batch of the dialysate. Now she does this 4 times a day. In between each session, she has to wait about 4 to 6 hours. Soon after this, well, she'll be doing this for a little while, then after that she'll go into what's called the continuous cycling peritoneal dialysis, which she will do that overnight for 10 to 12 hours while she's asleep. It's the same thing, except you're not doing this one manually, you're connected to a machine. Now, your options basically to be able to live is going through the dialysis, or you can do a kidney transplant. Now, what a kidney transplant is, you can get a living donor kidney or you can get a deceased donor kidney. Statistics show 98% live at least 1 year after getting a living donor, or 90% live at least 5 years. With the deceased donor, 94% live at least 1 year, 82% live at least 5 years. Pretty much the same. You're better off trying to get a living donor. Living donors can be from family members, friends. There's a lot of factors that go in with that either they have to be your certain blood type, And like there's just a lot of different things that go with it. Now with the deceased donor, you have a wait time that could be up to at least 3.5 years, but it can vary. My mom is on a, like I said, she was on a implant list, waiting list, but right now hers is probably about a 5-year mark. So like I said, it can vary. Now there's a lot of medication side effects that you have to take once you get the kidney transplant. What I'm going to show you first is, this is the donor from the donor which has a functioning kidneys. Now what they do, they just remove one, take it out, and instead of taking yours out, they just leave them in there and they add another, I guess another little port which adds the third kidney. Now that one kidney can function for both of your dead kidneys. Like I said, there's a lot of medication side effects which include acne, bone thinning, bone damage, diabetes, excessive hair growth, hair loss, high blood pressure, high cholesterol, infection, puffiness, weight gain. I mean, the list can go on. There are also a lot of complications that can go with it. Blood clots, bleeding, infection, cancer transmitted by the donated kidney, failure or rejection to the donated kidney. Now, these are different types that you can go through. This is not really everything. This is just a little glance of what these things can be. But I hope with my presentation you're able to take these things back to whoever might have questions about dialysis or about kidney transplant, and you're able to inform them that this is not the end. They are still able to, basically they can cope with it. They can go with their friends, they can go with family, they can still live a normal life, but this will take part of your day. So I mean, I hope you understand everything that I gave out to you, and I just hope you're able to take it back and be well informed. Thank you.